Hi, my name's Aubrey. I'm going to be your PA today.
Okay.
Do you mind if I take a quick history?
Yeah, of course.
Okay, it's actually not going to be that quick. I kind of lied.
Okay.
Okay, so can you give me your name?
My name is Sarah Smith.
Okay. And your date of birth?
It is May 1st, 1961.
So what age does that make you?
54.
And then can you tell me why you came in today, Sarah?
Yeah, for like a while now actually, I've been having like really just this really heavy cough and like mucus comes up and I feel like I just like am having a hard time breathing and sometimes I even get like a little lightheaded. And yeah, I've just been really having trouble with the whole breathing. I get short of breath really quick. And just this cough has been really, really bad.
Okay. I'm sorry to hear that.
Thank you.
So can you tell me when this started?
Oh God. It's been going on, I'd say, for like, it's been getting worse now for like, I'd say the past like 6 months. But I'd say the cough has been going on for, God, years.
Okay. And how many years have you had a Tavian?
Maybe like 4 years. I mean, a long time, but I'd say the cough has just been getting worse in the past 4 years. But recently, in the past 6 months, it's just been getting like unbearable.
Sorry to hear that.
Thank you.
And then, have you noticed if anything makes it any better?
I mean, resting does because I don't get short of breath and I'm not doing anything, but nothing else really makes it better.
And anything make it worse?
Well, walking and like doing like exercise does. And I mean, sometimes, actually, it's just bad all the time.
Yeah.
Yeah.
So it's bad all the time.
Yeah.
And then, do you remember something you specifically you were doing when your cough started, or when it started to get worse? Were you walking, or
No.
exercising in any way?
I feel like it's just been like a progressive thing that's just been gradually getting worse and worse as the time's gone on. I can't really put a marker on like what happened before.
Okay, so it's gradually been getting worse.
Yeah, definitely.
Okay. And then have you ever had this previously, as bad as your cough is now?
Not as bad as it's been now, but it's like I said, it's been going on for years.
Okay. And then can you describe the quality of your cough?
It's definitely like I get like mucus when I
You
cough.
get mucus.
Yeah.
And have you always gotten mucus?
Not always. I mean, I can't really tell you exactly when, but maybe in the past like year or so I've been getting like mucus and it's been getting worse and worse within the past couple months.
And are you feeling chest pain as well? Would you say that like there's pain and it's radiating to your chest? Or
I
is
wouldn't
it just
say
the
it's
cough?
like necessarily. I mean, it hurts when I cough because I'm coughing so like vigorously.
Right.
And so I would say that's mainly the cause like of the pain. But I don't know. I've been feeling like really anxious because like I'm having so much trouble like breathing, and I feel like especially when I'm doing activity, it's just like unbearable. I feel like I need to sit down after like walking for 5 minutes because I just can't breathe.
Okay.
Yeah.
I mean, it's so terrible when you can't breathe.
Yeah.
We take it for granted because you can do it so well.
It's really scary, and I feel like I've just been getting so anxious over like knowing when I have to do something or like go to an event. I get like anxious, and then maybe my breathing gets more heavy then because of my anxiousness, but it's been causing a lot of distress lately.
Okay. Well, we're gonna see if we can get to the bottom of this today. And on a scale of 1 to 10, can you say how much pain you're in?
I wouldn't necessarily say like pain, but like distress, I'd say like an 8.
Okay.
Yeah.
And what about, does it get worse at a certain part of the day? Does it get better at a certain part of the day? And with, seasons, does it seem to get worse during seasonal changes?
I think like in the spring it gets worse, maybe just because like I have allergies too. I noticed like I've always just had allergies during the springtime. So I guess I could say that it gets slightly worse during the spring, but other than that, it's kind of remains the same all day. It doesn't really change.
Okay, so it's not getting better at night when you're relaxing.
I guess, yeah, it doesn't wake me up really. Occasionally it does, but I don't really notice anything too bad when I'm sleeping.
And do you feel like anything in specific has brought on this cough? Have you noticed that you've been doing something that's made it worse in the past 6 months?
Well, I mean, I smoke. I've been smoking since I was like 14 years old. But I mean, I've always done that. It's not something new. So.
Okay. And how many packs a day have you been smoking?
From when I was young till like my 30s, I'd say maybe like a pack a day, but more recently it's been like pack and a half or two a day.
So you would say from the time you were 14 to 30, you smoked about 1 pack a day.
Yeah.
From the time you were 30 to now, you smoked about 1.5, occasionally 2 times, 2 packs a day.
I'd say so.
Okay. And I know you also said that you've been lightheaded and short of breath. Have you noticed that that's happening as the cough is worsening?
Yeah, I feel like when I'm like trying to walk and like I just can't get like I feel like I just can't get air like in or out, and it's just the whole breathing process is just so like distressful, and so I feel like maybe I'm getting lightheaded because of the fact that I'm getting short of breath. But it's definitely more when I'm like trying to do things.
And did you have this pain and lightheadedness and short of breath? Did you ever feel that before? Did you ever experience that when you were younger?
Mm-mm.
It's just gotten worse in the past 6 months.
Mm-hmm.
Okay. I'm going to ask you a few questions now. Do you know the color and quantity of your sputum?
It's kind of like whitish with a little like milky looking, maybe some green sometimes, but usually it's like white and milky looking or clear.
Okay. And how much of it are you? Like how much are you producing?
I don't know exactly how much, but every time I like get a good cough, I'd say like I'm able to like I spit it into a tissue and it's like a decent amount. Like I don't really know exactly how much, but I mean every time I really cough, something comes up.
I'm sorry to hear that.
Thank you.
Are you experiencing wheezing?
No, I don't get wheezing.
And have you ever noticed blood?
No blood.
And do you feel like there's any fluid in your lungs?
No, I just feel like I can't like sufficiently get like
air out.
Yeah, air out. Like I'll breathe, and then like I feel like it's like in there, and I can't just get it out like I used to be able to.
So you can't get air out, and I know that. So your chest pain you feel is only occurring due to the heavy amount of coughing that you're having, because you didn't experience this chest pain before.
Yeah.
Okay. And the shortness of breath have you noticed that in activity? I know you said in the past 6 months it's gotten worse, but is there an activity that you're doing when you're walking?
Just walking.
Just walking.
Yeah, I live in the city, and so I usually rely on walking just to get around because parking's so hard, and I feel like lately it's just been so hard just to get from like point A to point B, and I don't know, it's been rough.
And when was your last chest x-ray?
I don't think I've ever had a chest x-ray, to be honest.
Okay. Now, I'm just going to ask you a little bit about medications that you're taking.
Okay.
Are you taking any prescription medications?
No prescription.
Any non-prescription? Any Advil, any aspirin, ibuprofen?
Sometimes I take Mucinex. I try and take. But
and has that been more recently?
Yeah, more recently because like the cough, it hasn't really done anything, so hasn't been too helpful.
I'm sorry to hear that. And how much were you taking of it?
I don't know like the exact dose, but I took like 2 pills like a night, or no, I'd say more in the afternoon. I took pills.
And orally?
Yeah, that's all.
And how long were you taking it for?
I'd say I took it maybe a couple times a week for the past like 4 months.
And any other?
I don't take any other medications, but I mean I take vitamin C to try and not get sick.
And how long have you been taking vitamin C for?
Oh, for a while now, for years. Just something my mom always made me do when I was little, so I've just been doing it my whole life.
Once a day?
Yeah, once a day.
For almost your whole life?
Yeah, and it's like a big pill. It's like, I don't know how many, like, what the dosage is, but it's pretty big.
And you take that orally as well?
Mm-hmm.
And have you ever used any other types of vitamins or minerals or supplements?
I use a woman's multivitamin, like, occasionally. I kind of forget to take that one, but if it's out and I see it, I'll take it.
And when did you start taking it?
Oh, maybe like 10 years ago.
And occasionally?
Yeah, so like a couple times a week, I'd say. Once a day. Well, not once a day, but 1 pill when I take it.
Okay. And also orally?
Yeah.
And do you use any home remedies?
No home remedies. No.
Okay. And have you ever used any borrowed or old meds kind of laying around?
No.
Okay.
I've been told that's bad.
Right. Okay. And do you have any allergies?
I mean, I get seasonal allergies, but I'm not allergic to any like medications or anything that I know of.
I know, so you said your seasonal allergies tend to get worse in the spring.
Mm-hmm.
And have you ever been tested for any type of allergy?
No, I just always kind of, a couple years back, I would take some nasal spray for them. I don't know what it was called or anything, but the doctor gave it to me.
Okay.
Yeah.
And so is your reaction, I know you said you take nasal spray, so you're having...
Yeah, like congestion, like runny nose, and also coughing, but I don't know, that may just be because I cough a lot these days.
And when would you say this started to develop? Did you have it as a child? Did it develop
My whole life.
Okay.
Yeah, my whole life I've gotten allergies in the springtime.
And you don't tend to get allergies in the fall or summer?
Just the spring.
Okay.
It's like in the transition.
Okay. And have you ever gotten rashes or any other type of adverse effect that you can remember?
Sometimes some puffy eyes, but other than that, nothing crazy.
Okay. And what about any allergies to drugs?
No, I don't think so.
Or any food allergy?
Mm-mm.
Okay. Just to the environment mostly?
Yeah, just like environmental.
Okay. How would you describe your health as a child?
I'd say it was pretty good. Nothing too crazy.
I'm going to ask you some questions and let me know if you've ever had any of these diseases.
Okay.
Have you ever had measles?
Nope.
Mumps?
Nope.
Rubella?
Mm-mm.
Whooping cough?
Nope.
Chicken pox?
Yeah, I've had chicken pox.
Okay. And can you tell me about how old you were?
It was maybe like, I was young, like maybe 5 or 6 years old.
Okay. And have you ever had rheumatic fever?
No.
Scarlet fever?
Mm-mm.
Polio?
Nope.
Diphtheria?
Mm-mm.
Varicella?
No.
And have you ever suffered from chronic ear infections?
Yeah, when I was little, I remember I had I think it was like a tube or something put in.
Oh, really?
Yeah.
Okay. Do you remember if you had it done on both ears?
I think it was just my right ear.
And did you notice that started to help? Or did your mom ever say that made a difference?
I mean, I haven't had them, I don't think, since, so, I mean.
Okay. And then for all of these measles, mumps, rubella, did you get the MMR vaccine?
Yeah, I think so. But my mom was in charge of that. So.
Okay. And do you know if you had the varicella, diphtheria vaccine, polio?
I don't know.
Okay. But you didn't get them?
I did not.
Okay.
Yeah.
So now we're going to go into more about your adult health.
Okay.
How have you been as an adult, your health?
I'd say pretty good. Nothing too crazy other than the whole coughing thing.
Coughing.
Yeah.
And would you say with the coughing, so I can get a specific time when this started? I know you said you were young and you've been coughing for a lot of years.
I mean, I'd say that like I got like a little bit of a cough maybe as early as my 30s. I noticed like a tiny cough, but nothing that would like disrupt my day. And then it just got like worse, I guess, as I've gotten older.
And did you notice when you were younger that you had any mucus in your cough? It was a productive cough.
Just like a dry cough.
Yeah. And so what time, I know you said it's gotten worse the past 6 months, but around which time did you start producing mucus?
I'd say some mucus started coming up in like the past like year and a half.
Okay. So I'm going to ask you about some other diseases that may apply to you.
Okay.
Let me know if you have them.
Okay.
Do you have hypertension?
No.
Diabetes, mellitus?
Mm-mm.
Any hepatitis?
Mm-mm.
Okay. Has anybody diagnosed you with asthma?
No.
And any COPD?
No one's ever told me I've had anything like
Okay. Have you ever been diagnosed with HIV?
that.
Thyroid disorders?
Nope.
Any cardiac disease?
Mm-mm. Not that I know of.
Okay. And have you ever had cancer?
No.
And any kidney disease?
Mm-mm.
And any a pulmonary embolism, a deep vein thrombosis? Have you ever been diagnosed with those?
Mm-mm.
And can you think of any other illnesses or diagnoses you may have had in your adult health? Okay. Okay, so can you tell me how often you see your obstetrician?
I go for a yearly visit, yearly checkup.
And how has your experience been with a gynecologist?
It's been good. I've had the same one since my son was born.
Okay.
So yeah, she's been great. I mean, we have a long relationship, so I feel comfortable going to her.
And can you describe your menstrual history?
It's been normal. It's normal flow. Nothing.
And nothing's changed recently?
Mm-mm.
So you still have your period?
I do.
Once a month?
Yeah. I know they say I should be going through menopause soon, but
you haven't experienced.
Hasn't hit me yet, so I'm happy about that.
And do you use contraception when you have sex?
No.
And how would you describe your sexual function?
It's good. It's pretty good.
And have you ever had difficulties with your sexual function?
No, I don't think so.
Okay. And I know this is a personal question, however, I do ask it to all of my patients. Have you ever been diagnosed with any type of mental disease? Okay. And have you ever seen a psychologist? Okay. And can you tell me a little bit about accidents or injuries that you've had over the time of your life?
I was ice skating like 2 years ago, and I fell and broke my wrist. I don't know if that's considered an accident.
Yeah.
Not very coordinated.
And did you end up in the ER or urgent care?
I went to the ER and they put a cast on me, and I just went back like 6 weeks later and they took it off.
It's crazy when they take the cast off how atrophied your muscles.
Oh, I know, and like I had all this scaly skin and it looked like it was gross looking.
Have you had any other complications from that?
No. No complications. It's pretty good. Got the cast on, got it off, and I was on my way.
So you generally say that you haven't had any other issues from that?
No.
Any other accidents or injuries?
Oh yeah. I was cutting a watermelon like a couple summers ago, maybe like 3 summers ago, and I was using this really big knife, and I accidentally sliced my finger really bad, and I had to get stitches. Yeah. My family eats watermelon like it's going out of style. And I think I got like 10 stitches in my finger.
Okay. And how long did you have the stitches in for?
Like 2 weeks, maybe.
And did you have any complications from that? Mm-hmm. And how was the general outcome? Do you still feel like you have full function of your finger?
I still have full function. I think it was just kind of like a superficial thing. You know?
But I'm sure it hurt terribly.
Oh my god, it hurt so bad. I thought I cut my finger off.
And have you ever been hospitalized before?
No. I mean, when I had my son, I was in the hospital, but I mean, other than that.
But you've never been in a hospital for overnight?
Mm-mm.
Okay. And how about any surgeries?
No surgery.
No surgeries. Okay, I'm gonna ask you just a couple questions, see how, if you are maintaining your health.
Okay.
Have you ever had a colonoscopy?
Yeah.
And do you remember how long ago you had a colonoscopy?
Got it when I turned 50, so 4 years ago.
Okay. And do you remember the results?
Said everything was normal.
So, do you remember if they specifically said there was no cysts or there was no polyps?
I think they just, I don't know. I don't remember anything specific. They just said it was good, yeah.
Okay. And have you had a mammogram performed?
Mm-hmm. I get one, like, every year since I was, like, 45, maybe.
That's great.
Yeah.
And have you ever, what was the results?
Always good.
Remember?
Yeah.
Okay. So they didn't find any lumps, and your physicians always said that it looks good.
Yep.
Okay. And how about, have you had any pap smears?
Mm-hmm.
Mm-hmm. And how often do you get a pap smear?
At my yearly checkup. For the gyno.
And what about your gynecologist? Has she said anything?
She said it's always been normal.
He or she?
She has always said it's been normal.
And have you ever gotten a TB test? Or sometimes they call it a PPD?
Yeah, I've gotten one of those maybe like a couple of years ago. I started a new job and they wanted some tests done.
And do you remember and obviously you said you've never had a chest x-ray.
Yeah, I've never had a chest x-ray. They did the thing where they like inject it and there was no bump, so they said it was good.
Okay. And that was about 2 years ago.
Yep.
And how about, do you get blood work done, to test your cholesterol?
Yeah, I do. I get blood work like every year, my annual physical. And I mean, other than occasional like drops in some numbers slightly, there's nothing too concerning. One time they said my iron was a little low, but I just took some supplements and I was on my way.
Okay. And have you ever had a bone scan done? Sometimes they're called DEXA scans.
I don't think so.
And can you think of anything else, any other type of test or screening test that you've had performed?
No, I don't think I've had.
Okay, well, it seems like you're really keeping up on everything.
Yeah, I always want to make sure that I'm staying healthy and, not being stupid about things and getting my tests done.
Well, great. I'm just going to ask you a little bit about your family history now. Can you tell me a little bit about any illnesses or diseases that have occurred throughout your family?
I mean, my grandparents aren't with me anymore. They died like a long time ago. But I know, thank you. I know that they both had lung cancer on my mom's side. That's what they died of.
Both of them have lung cancer?
Yeah, they both had it.
Okay. And can you tell me about the age that they were when they passed away?
I'd say like my grandma was 60, and maybe my grandpa was about 70.
Okay. And do you remember how your paternal grandparents passed away?
I don't know. They were just really old.
Oh my god.
Doesn't it take so?
I'm sorry. I think we're done with this.
Oh.